Well, good morning. So my name is Ian Pollock from Orano, Canada, up at McLean Lake, about 750, 800 kilometers northeast of here. And when we were asked if we would like to participate in the panel, we said yes. What an opportunity to share our story. And then we said, well, what does that look like? How are we going to tell our story? So as the screen shows, where's our presentation at? Right there. We're going to take you from where we were, from a stigma point of view, to the discussion point of view is where we went. I'm going to hopefully walk you through some of the topics that I have here, basically telling you from where we are at to where we are now, to what the future looks like. And it was an eye-opening experience that we started a couple of years ago. Like so many companies, these would help. Like so many companies, if not all companies, Orano believes that the safety and the mental health of our employees is a cornerstone to their success. Our company is committed to the protecting the health and safety of our workforce. As such, Orano understands that the psychological health and safety in the workplace and at home is an essential aspect of our employees' well-being, and that our company must better understand, monitor, and provide adequate support. The problem was, we really didn't have an appreciation for where we were at with regards to mental health in our workplaces. There were a few employees discussing it, but it's not really a topic that was front and center of people's everyday conversation. We did have some lagging indicators, however, like absenteeism and the use of our Employee Family Assistance Program that certainly provided that, hey, you need to go have a closer look. And so we did. We then realized that our internal teams lacked the knowledge and understanding to assess mental health within our workplace and assess potential concerns. So Orano engaged Bridges Health here in Saskatoon to first assess the existing mental health and wellness of our workforce through a confidential mental health survey deployed right across our entire organization up at McLean Lake and in Saskatoon, and then to prepare a report on the survey's results. So the report from the results provided us with a better understanding of where we were at in the areas that we needed to address. We certainly had some shortcomings. These were not viewed as failures, but of course as as opportunities for improvement. Our theme, our approach, was what can we do to make the workplace better, and what are we in control of? We cannot control what happens outside of the workplace, but we can provide supports and education to our employees while they're at work. We can also create a physical workplace that is more conducive to supporting our employees. Following the assessment campaign, we implemented initiatives to educate employees on mental health and wellness, work on removing the related stigma around mental health, and provide people with tools and knowledge for self-help and potentially assisting coworkers and loved ones at home. We simply wanted to get people thinking and talking about mental health. Our senior management, key leaders, and supervisors were provided with mental health first aid training as another tool to allow them to better support their employees generally, and particularly in times of crisis. As well, we implemented employee-focused training sessions on the foundations of mental health, and specifically a Taking Care of You workshop and a Respectful Workplace workshop. These sessions, they were dynamic, they were interactive, and they gave employees a chance to learn together and discuss and share their personal experiences with mental health and wellness, and what it means to contribute to a respectful workplace. Each year, Orano conducts what we call safety days. These are 2 days of the year which are dedicated, as the name suggests, specifically to safety. So with our focus on mental health, our keynote speaker last year was none other than this fella here, That's Theo Fleury, who's certainly well-versed in the area of mental health issues. It is an understatement to say that Theo's talk was engaging and impactful. After his talk, Theo even took the time to walk around and meet with employees in their workplaces and shared conversations, and nothing was off limits with this guy about mental health, and of course a little bit about hockey as well. Other components of our commitment to fostering a workplace conducive to mental health and wellness and supportive of our people has been having site elders. These folks provide personal and confidential engagement with employees. As well, Orano continues with a systematic review of all of our human resources policies and procedures to ensure that they are all written and implemented with mental health in mind. And we utilize a fair and just culture review as applicable for incident reviews. From a physical workplace perspective, we have a dedicated, spiritual room located at camp for employees. This room is available for anyone to practice their faith and is also used to support groups who meet, such as AA and NA. As well, we have made and continue to make improvements to the workplace aesthetics, including a painting of our main mill corridor and our processing mill as a serenity wall, with gentle tones of color that are conducive to mental health. If you can see it, there's actually 3 shades of white on that wall, all meaning something a little bit different. We have a full-scale, large northern wildlife and landscape mural in our games room at camp. We've 5S'd our entire mine site and our Saskatoon offices to make for a more pleasant and organized place to work. And we're in the process of redoing our camp lobby to include yet another large-scale mural, as well as a static display to recognize and to honor our impacted neighbors in northern Saskatchewan where we operate. So the future. Our leaders are now better prepared to approach mental health with a more educated perspective and armed with some knowledge and some tools to help employees when necessary. Our initiatives have demonstrated to our workforce that our company and our leaders care for the well-being of our people. The work that we do in terms of mental health and wellness has certainly raised the awareness amongst all of our employees and the prevalence of mental health and the importance of paying attention to our own mental health and to those of the folks around us. Orano's efforts have certainly helped reduce the stigma surrounding mental illness and has generated important conversations throughout our organization. The feedback received from employees to date has been extremely positive, and subsequently, many have made suggestions to ensure that mental health and wellness remains top of mind and the workplace environment remains supportive. In fact, the mental health initiatives at that same 2018 Safety Days that Theo spoke to won what we refer to as our Success Awards, and that's voted on by employees. Locally, Orano was also recognized as we won the 2018 ABEX Awards, the Priority Focus Award category, which is presented to a business that has gone above and beyond in demonstrating business excellence in the area of mental health. But the success doesn't mean we get to sit on our laurels. We're pretty happy with what we've done so far, but we're even more encouraged by the fact that we have folks thinking and talking about mental health. Because mental health issues can affect the newest employee to the most senior person. So our company will continue to approach the psychological health and wellness in a holistic way by continuing to provide materials, formalized training to our employees, as well as more opportunities to create a sense of community by furthering our networking events through our Saskatoon office social committee and through our McLean Lake Recreational Club. We're committed to work towards addressing the needs of our employees and to continue to get out in front of potential issues as opposed to dealing with the consequences that come from them. It's our hope that employees will take these mental health tools home with them to improve the mental health of their family, of their friends, and of their community. We're also going to look ahead for more opportunities to reassess where we're at. whether it's through a psychological health and wellness survey or through more of our Voices of the Employee surveys. The success of our company, all of yours, lies with the people that you work with each and every day. We recognize that having a mentally healthy workforce is not only beneficial for the employees and the families, it's also beneficial for their coworkers, their team members, and the business as a whole. Indeed, employees are happy, they're healthy, they're focused on both their mental and physical wellness, are more motivated, productive, and engaged employees, and also back in their community. Thank you for the opportunity to share our story, and I look forward to hearing to the rest.
Can everyone hear me all right? Perfect. It's a privilege to be here this morning and share with you a little bit about our journey here in Regina. And as Kevin mentioned, we are a nonprofit organization working predominantly in the Regina region, but working with a cross-section of health. Oops, let's move this on here. So this is, what we're going to share with you this morning is a little bit about our journey. And I say journey, it's very intentional because I believe that we're all on this journey together, right? And that we all have a responsibility and commitment to ensuring the psychological health and safety of our employees. And yet, for each and every one of us, our entry point on this journey might be a little bit different. But it's how we choose to work together and collaborate across our province to be able to strengthen the efforts of each and every one of us. Right? As Kevin mentioned, CORE, it's a nonprofit organization. We're working in the realm of health, justice, and social services, and serving approximately 20% of the province's most marginalized children and adults here in care. Right? The organization was founded 10 years back and has grown to over 200 employees here today. And this has been over the last 10 years, we have learned a lot, not only in how to provide better care for our community's marginalized populations, but how to provide better care to our employees. The work that we do, when we talk about the challenge that we face, we're asking our caregivers the work that they're doing is not necessarily physically demanding, but it's emotionally demanding. Right? And each and every day, these folks are providing supports to people who can have, having some really rough, challenging times of their own, right? Which really was important for us in taking a moment to reflect on what are we doing to ensure that those caregivers are feeling safe and are feeling secure, right? Our organization is rooted in a philosophy of care, and that philosophy of care is sort of an alternative approach to caregiving called gentle teaching. And, that approach to care, albeit that was the foundation of the support that we began providing there 10 years ago, we quickly realized that this philosophy of care needs to encompass not only the people that we serve, but every person that touches the organization. And what I mean by that is that it's our partners, it's our funders, it's our stakeholders, it's the families, and it's the employees that work for us, right? And when we think about this philosophy of care, really what we're talking about is relationship, right? We're putting relationships at the core or at the center of caregiving, okay? And 10 years ago, we sat back, and I guess it was about 8 years ago now, we sat back and we thought, wow, this philosophy of care is really transforming the lives of the folks that we're serving. But this is more than just a philosophy of care, right? It needs to be more of a way of being, right? So we took that step back and we realized that this philosophy is not just for those that we're providing services to, but it really is the way the organization, it really needs to be the way the organization operates on a go-forward basis. And what that looks like is, in essence, how we choose to value and respect our employees, right? Looking towards our employees and evaluating the relationship that we have with those employees, understanding what's important to those employees and what's important for them, because those are two fundamentally different things, right? We also, when we think of this foundation, the foundation rests in, do the people we serve feel safe and feel valued? Well, the same applies for our employees, right? Do our employees feel safe, right? And I'm not talking about physical safety here. I'm talking about emotional safety, right? Do our employees feel safe? And do they feel valued, honored, dignified, respected, right? And how do we get that information, right? How do you know, right? We quickly realize that when your employees feel safe and valued, they're more connected, right? They're healthy and they're more engaged, right? And what we're talking about here is essentially values. So for us as an organization, what we began doing was understanding what are the values of our employees, right? I can tell you 10 years ago, we crafted a wonderful set of values and a mission, vision, and value statement and proudly displayed it in the organization, right? But I began wondering, do these values actually resonate within our employees, right? It's great to have a set of values on the walls, but if nobody believes them, then what good are they there for, right? And the reality is, there's the values that the organization espouses, but then there's the perceived values that exist within the workforce, right? And for us, this journey involved a discovery about the individual values of each and every employee that are working for us, and collectively, what are their perceived values of the organization. And through that process, we were able to refine not only our organizational values, but we saw values alignment, right? And when there is values alignment is when you see people really flourish, and you see organizations flourish as well, right? This process of exploring our values led us to not only explore those values of our employees, but led us to explore our very own policies that the organization has embraced. Because are those policies that exist on paper congruent with the very values that we believe, right? And looking at shifting and changing those organizational policies so that they were more congruent with our values. It also led us down the path of looking at our HR practices, looking at our recruitment practices and how we hire people. Are we hiring for values, right? We've completely shifted and turned our HR process on its head, and I can tell you that after 10 years, only today have we finally done away fully with a performance management system, right? That's been a work in progress. Because what we realized was that performance management process, right, the dreaded, 360 evaluations that happen every year, wasn't congruent with the values that we held as an organization. That felt a little bit clunky, right? When I think about our journey, really it began with an understanding and a discovery of the why, right? Why we do what we do, right? And when we think about from the perspective of psychological health and safety, why are you choosing to embark on this journey? Is it because you were told to? Is it because there's been a change of legislation? Is it because you want to reduce your absenteeism, right? You want to increase engagement and reduce presenteeism? Is it because it's just the right thing to do, right? And for us, what we quickly and we know today is that we're in the business of caring for people. And that when we think about caring for people, it starts with how we choose to value and respect our employee and how we choose to care for them, right? That's the starting place for us, and that's our why. And it's important for organizations to explore their why so they can enter and begin their journey with a clear understanding of where they're at. We also, as an organization, embrace the national standard, right? So as many of you may realize, the National Standard for Psychological Health and Safety in the Workplace was released in 2014, I believe, right? And within that national standard, there are 13 factors, right? 13 psychosocial factors that if they exist within that workplace, in theory, you should be able to mitigate and the potential for psychological injury. Now, for us as an organization, we really began to understand what are those factors, exploring what those factors meant to us, but also looking at those factors a little bit differently. And what I mean by that is looking at those factors through the lens of risk, right? These are, in essence, these are 13 factors as risk indicators, right? And if we're not working on one aspect or in one area of those 13 factors, if one area is left to the side, we are increasing the likelihood that someone will experience a psychological injury within our workplace, right? So it became equally important that we focused on all of those 13 factors. But it didn't mean we jumped in and started doing everything all at once. It just really, it really isn't possible, right? But what we did was we began taking stock, looking at those 13 factors and looking at what are we currently doing, right? And evaluating where we're at. And I can tell you what we quickly realized was, man, we were further ahead than we thought, right? And when you sit down, you do that, participate in that activity and take stock in where you're at as an organization, it becomes all that much more clear where you need to focus your efforts and to pick and to choose that one or two areas that you're going to concentrate your efforts over the next, months and years to continue to work and deepen that culture that exists within that workplace, right? When we think about this journey, there is no magical end state, right? It's a journey. It's a continuous journey. And it starts with leadership commitment. It starts with leadership. It starts with the leadership in each organization, and from there, it's assessing where are we at, what are we doing, right? And then you begin planning, moving into implementation, and then ultimately evaluation. It's this very cyclical cycle, right, of continuing to reflect on what you're doing as an organization to advance the work as a whole. With that, I thank you.
All right, so my name's Jana Spile, and myself and Brian Lloyd, we're going to talk about executive government's journey on implementation of the national standard for psychological health and safety in the workplace. What we consider executive government is our 17 ministries, along with Executive Council and the Public Service Commission. So healthy workplace is the term that we're using, just as an easier term to use as opposed to repeating national standard for psychological health and safety in the workplace, which is a bit of a mouthful. Basically, when we decided to take on healthy workplaces, it wasn't to start something new and fresh. It was to take a system approach and look at what already is existing and combine those efforts to best suit the goal of maintaining a psychologically healthy and safe workplace. Our guidance is through the standard, the national standard, so that is a document that's available through the Canadian Standards Association, and it's a document that was created mainly by the Mental Health Commission of Canada. So I'm going to pass it over to Brian to talk a little bit about our governance structure within government and just a little bit about our leadership support to get to where we are at today.
So we'll talk about the leadership support piece. Essentially, if you're going to look at the daunting task of implementing the national standard, you're going to need a top-down and bottom-driven approach. We're very fortunate in the government of Saskatchewan we have a Safety Champion Council. Our Safety Champion Council is one designate from each of the ministries from executive government, typically a deputy minister level or assistant deputy minister and delegate. They're responsible for championing safety in that ministry. They meet 4 times a year, and this really gives us our buy-in from the senior executive level and allows us to really drive that forward. If you don't have that top-down driven commitment to this, it's a very, very big challenge. You need that commitment. It's a big task to implement the national standard. It takes a number of years, and we're very fortunate to have that safety champion structure. We're growing it from the grassroots with some of our Healthy Workplaces Committee, our OHC committees. We've got lots of employee engagement, so we're kind of growing it in both ways. But certainly, You need that top-down commitment to be able to drive this one forward. Leave it to the government guy to pull up an org chart, and this would have been really tough to do without slides, so I'm very glad we got slides at this point. I really like this slide because at the middle of this, you can see our Safety Champion Council. So as I've said, kind of our deputy minister, assistant deputy minister commitment, and it shows that they report directly to our deputy ministers. Our deputy ministers are aware that from a regulatory perspective, they're accountable for OH&S, but from a programming perspective, we have key performance indicators associated to our DMs. Each year, their scorecard, their performance measure, rates them on their total injury rate within that ministry, and it rates them on their psychological safety climate score. And so we have our executives being directly measured on how well they perform when it comes to health, safety, and wellness. So this is very important. When we get a little bit of pushback from ministries saying, oh, geez, this is tough, it's going to take lots of extra effort, roadblocks, a little bit of red tape, we say, you know what, talk to your safety champion if you're having problems with this. And they'll say to us, well, who's that? It's your deputy minister. Okay, so then they fall in line and we tend to get things done. So very effective structure. You'll see that it's supported by the Public Service Commission. We very much take on the role of the Secretariat in carrying out those tasks. We have operational committees that support the safety champions. So these are health and safety professionals from ministries that work together. We work collaboratively to develop guidelines, policies, training modules, and it kind of gets carried out that way. So for us, structurally, this is very important. This is kind of how we're able to move forward. This slide here, it's a little bit busy. It's a framework slide, but it shows how our programs are measured and aligned for Government of Saskatchewan. So lots of organizations out there, you'll have EHS, you may have OHS programs, or you have a safety branch. For us at Government of Saskatchewan, we're health, safety, and wellness. That's how we manage the program, and that's how it's structured. So when you look at the slide, we have essentially 3 pillars. We've got your classic health and safety, so our OHS aspect. We've adopted the safety management system foundational pillars. We're working towards continuing to roll that out. In the middle, we have healthy workplaces, and essentially this is Jana's program. This is the Government of Saskatchewan implementing the national standard. That's when you see healthy workplaces. And then our third program stream is the Be at Work, which is essentially accommodation, so medical accommodation, return to work. We've got a new vocational rehab consultant working in that role and very much actively managing those claims.
So to talk a little bit about how we got the buy-in and support and the information we would share out in ministry land, talking about why it was important to implement the standard. World Health Organization has had this information out for quite a bit, that depression is going to be the second leading cause of disease by 2020. There's also lots of business case information that a person can get their hands on about the costs to the economy. 500,000 Canadians don't go to work each week due to mental illness. And then there's also a key piece about the Saskatchewan Employment Act. And there is that legislation for the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers. So we do have that obligation as an employer to look after our employees and create those healthy workplaces. The Government of Saskatchewan also has a commitment to excellence about the type of values and behaviors we want to see out of everyone who works for the government. So one of the key pieces that is highlighted there is considering safety in all that we do, creating that supportive, safe workplace for our employees. And then again, sharing the information about what would happen if we aren't addressing this, if we aren't moving forward on initiatives, doing more proactive, preventative stuff. So seeing those higher rates of absenteeism, presenteeism issues, disability claims will go up more, injuries and illnesses will increase. You'll see grievances, complaints, high turnover of staff, people not wanting to stay in that work environment. And then of course there's the legal implications. So the Government of Saskatchewan journey, back in 2013, our Safety Champions group, which Brian had referenced, was introduced to the standard. In 2015, they endorsed the adoption of this, and this was then approved by our deputy ministers. So in 2016, we started forming healthy workplace steering committees. So each ministry brought together members to help work on behalf of each ministry. As you might understand, the Government of Saskatchewan has around 12,000 employees. Each ministry is going to have different unique needs of what they need to highlight to focus in on. So that's the structure that we used is to create these committees. So one of our guiding documents, another useful tool that falls in line with the standard, is assembling the pieces. And again, this is another downloadable item on the Canadian Standards Association website. So it breaks down how to do an implementation of the standard into 4 phases. And that's the guide that we had used. So kind of before we started the first implementation stage, we made sure that we were readying our organization. So just starting to bring some general awareness, reducing stigma, readying our employee and family assistance program for anticipated increased usage. So in 2016, we started with phase 1, which was building the foundation. As I mentioned, we had that deputy minister support from that council, formed our Healthy Workplaces Steering Committee. We then moved into phase 2, which was identifying opportunities. And this is where we had a hazard and risk assessment, where each ministry's Healthy Workplace Steering Committee would take a look at those 13 psychosocial factors that was referenced by Michael, and I'll touch on it a little bit more in these coming slides. There's 13 factors that the workplace has some influence and control over. There's things that we can do to help promote a healthier workplace. So each ministry used a variety of different tools, such as our safety survey and employee engagement survey, as well as work-related employee and family assistance program data, and took that information, completed an assessment to identify the top 3 areas that they needed to focus in on. And then that moved us into setting objectives, which was number 3, creating action plans. So each ministry then identified their 3 factors they were going to focus in on, what types of education, resources, tools they were going to spread out to their ministry, whether it's specific learning programs or lunch and learns, and then created some measurables, how to make sure to measure success on the programs that they were rolling out. And then that takes us into stage 4, which it doesn't end at stage 4. This is where it's that continuing journey that we're taking a look each year, reevaluating the plan, reevaluating the data, reevaluating what it is, what's working, where we still need to put extra resources into. And there's also another audit tool that comes along with the standard that you can use in your workplace to measure up, to make sure you're doing everything policy-wise, process-wise, to have that completely psychologically healthy and safe workplace. So just for a quick view, these are the 13 psychosocial factors. And again, there is information out there that has little YouTube videos about each of the factors, really easy to bring back into your workplace for little lunch and learns. There's also resources and manuals for kind of facilitator guides and questions to go around each of the factors. So there's lots of information out there for organizations at any stage, small or large, to start implementing these actions. So the government of Saskatchewan, what we identified last year as kind of our top 5 areas was in the areas of workload management and balance, psychological support and protection, and clear leadership and expectations. So that was the government-wide information. Each ministry may have 3 that are a little bit different, but there were some similarities amongst all of them. And another piece that we did was we took a lot of the information that's out about each psychosocial factor and created online learning modules, kind of put our government of Saskatchewan touch to match with our HR policies, and that's going to be free online learning tools that can be distributed to 12,000 employees, speaking to both employers and managers. And from here, I'll pass it back to Brian to talk a little bit about one of our survey tools.
So one of the questions always gets me, well, how are you measuring the success of your programming? We have 2 measures that come from our Eurovar Sask Safety Survey that's done annually. We've been doing it from 2016, so we now have 3 years of data. We measure our physical safety climate score, which gives us a number, so we try and achieve that number or improve on that number. And we also have a psychological safety climate score, so we get that every year. In terms of implementing the national standard, we certainly rely on the psychological safety climate score as a target and a key measure for the success of that program. We get a third data point and measure from the U of R safety survey as well, and that's our psychological distress score. So we're looking at how we're going to use that as a measure moving forward, but those are three key measures that we get from that SAS safety survey. Very, very important for measures. And then the last slide talks about really about the training piece. So when you implement the national standard, one of the criteria is that you need to provide resiliency-based training to your employees. So what does that look like? What is that? Currently, we're in a pilot project right now with WorkSafe SAS. They're the contract holder. The vendor who's providing the training is the University of Fredericton, UFred. So they've developed some training from Dr. Rakesh Jetli and Dr. Samra, who helped write the national standard, have some work with NATO, some work with R2MR, work with the RCMP, and they've developed some courses in their resiliency and courses in their managing psychological health and safety suite that we're testing, we're piloting right now. Our other stakeholders, the U of R, so Dr. Sean Tucker's shop is going to measure this training, and we're looking at rolling it out right now. We're currently at the stage of random selection, so each of our ministries is going to participate. We're going to have certain units that are going to be randomly selected, certain number of control groups randomly selected, and this training is rolling out throughout April and May, and by the end of the year, the U of R will validate that training. They're going to compare it to our previous SAS safety survey scores, so we already have data, benchline data dating back to 2016, and then by the end of the year, we'll have a good idea of how effective that training was with UFred. That wraps up our presentation.